The Tasmanian child protection system has been in the spotlight, I guess, for over 18 months now, with shortcomings on the northwest coast, particularly where things went unreported. And there's been a fair bit of pressure on the government to improve it. And as yet, it seems to be moving very, very slowly. And to add fuel to the fire, Anglicare has today released its report, Too Hard, Highly Vulnerable Teens in Tasmania. And it's not good reading, I've got to say. What it tells us is that the system is well and truly not coping, and there are young teens in danger slipping through the tracks. The author of the report is Dr. Catherine Robson, who's a researcher at the Anglicare Social Action and Research Centre, and she joins me now. Good afternoon, Catherine.
Good afternoon.
Thanks for your time. Now, I guess the first thing I should ask you, for people who don't know, when we say teens, we're talking about children between the age of 10 and 17 who experience significant harm, including forms of family violence, childhood and adolescence as well. So were you shocked or were you surprised with what you found when you compiled the report, or was it what you expected?
Look, I've been doing research in the area of homelessness and complex trauma for some time, but I have to say I was shocked in undertaking this work. I think in particular what shocked me was young people's reports of chronic domestic violence, and of course just that kind of repeated harm that they experience from childhood into adolescence. It's just not okay.
No kid deserved to live like that, that's for sure. But what you also found in the report is that they've been failed by the system. There's been systemic failure, hasn't there? That the support hasn't been there that they need.
That's right. So the report really does focus on a kind of two levels of abandonment, if you like. So young people do experience abandonment in their own family environments, but just as importantly, when they leave those settings, they're then experiencing abandonment in the community by, the under-resourcing of services that should be there to support them.
You found that a lot of the kids that you looked at and spoke to were put in the too hard basket. Is that the situation?
It is. I think we are talking about a very specific cohort of young people who experience multiple adversities and have multiple needs. And that can really overwhelm services that are often focused on a single issue. But with coordination of support, young people would get good outcomes, but that lack of general care and coordination is simply not available for them.
You've mentioned that Child Safety Service in Tasmania is not equipped to respond to these cases. What's the fix for that? Is it just a matter of throwing more money at it, or is it a bit more involved than that?
I think fundamentally it is resourcing and staffing. I think child protection workers know how to work with young people. They know how to help them, but there's just not enough of them. Child protection workers and lots of other services, staff in other services, really stress that there doesn't seem to be faith in the child protection system, in those out-of-home care options that we currently have. They're just not set up to respond adequately to young people who have very complex needs.
Some of those complex needs are made even worse or exacerbated, I guess, by mental health issues that arise from them and substance abuse and things like that as well. Yeah,
absolutely. And again, the report really draws attention to the fact that in Tasmania for under 18s, there are not drug detox and rehab facilities available. And further, there's not the community mental health support that's also needed. So, in some ways, with those key pieces of the support puzzle missing, it's very hard for young people to get the holistic support that they need.
The report's only been published today, so I guess that the government probably haven't had time to digest it, but you'd be hoping that the government would take notice of this, surely?
Yes, of course, and we'll be directly providing briefings to all the relevant agencies. And of course we're really open to sitting down and talking with whomever's interested in, I guess, taking a closer look at the ways forward that we're mapping out.
Okay, well, the opposition, of course, and I don't want to make this political, but the opposition have had a crack at the government today for the way they've handled the child service issue, particularly over the last 12 to 18 months. What's your view on it? Has it been mishandled, or is it just that, as you say, the resources aren't there to do it the way it should be done?
Look, I am not a specialist on the child protection system, but what I can comment on is from the research work that we've launched today, there's not faith in the out-of-home care options that the child protection system provides, and it is a case of more staff on the ground and with more capacity, I guess, to respond intensively to those people who need that complex engagement.
The research is available online for people to look at it as well at www.anglicare.tas.org.au. And we should point out that the research contains graphic descriptions of family violence and other confronting material. So if people have trouble dealing with that, then maybe they shouldn't look at it.
Yes, we've also provided some follow-up services, the contacts for those. So if people do want to have a look at the report and feel anxious for whatever reason after and need someone to talk to, there's some clearly stated numbers that they can contact.
Yep, and they're on the report as well.
That's right.
Yep. Okay. Well, Catherine, thanks for bringing it to light today, and let's hope that it doesn't just lie in a minister's inbox and collect dust. We want action done on this. It's obviously long overdue and very much needed.
That's right, and SARC will be continuing, to provide an active voice on these issues, so we're not going to let it sit in anyone's in trade, let's put it that way. And
SARC is the Social Action Research Centre for Anglicare. We should point that out as well. Catherine,
that's right, yes.
Thank you for your time today. I really appreciate that, and as I said, I hope that this report gets some traction and people start putting in some of its recommendations into action.
Thank you for taking time to speak with
You're welcome. And once again, if you want to have a look at that report, it's at www.anglicare.tas.org.au. And as we said, there's some confronting material in there. And if it does disturb you, you can contact Kids Helpline, 1800 55 1800. National Sexual Assault, Domestic Family Violence Counselling Service, which is 1800 RESPECT. And as always, Lifeline, 13 11 14.